if you look at my career in spinal research, I started out at the NIH doing molecular biological research. And that really taught me that there are working blocks of cells that if you can really figure that out, that you may be able to get the cell to perform differently. My biggest focus right now is actually in the field of regenerative medicine, which really means using cells or stem cells to try to regenerate tissue. I think in spine surgery, we've always felt that we're always treating a degenerative cascade. Patients get older, and that's just natural. We've always tried to impart other things to the spine, whether that's fusion or other devices to try to help and kind of support the spine. And the idea is that how can we really change that into the new millennium and use cell technology or even regenerative therapy, whether that's stem cells or other biologic agents, to really help recreate the beginning of the disc or the beginning of the spine. So really more of regenerative capacity, utilizing cells and molecules to try to restore the spine instead of using other devices to basically fix the spine. Right now we have a grant from the California Initiative of Regenerative Medicine. It's a $3 billion fund that Arnold Schwarzenegger started here with California taxpayers. It's a very competitive system. We have a grant looking at the use of systemic stem cells in the delivery to help heal fractures of the spine. So one of the big difficulties with fractures of the spine is that it's very difficult to get there. So if you're going to operate on a fracture of the spine like we did for that individual, it does cause a lot of what we would call surgical morbidity. We would have to open the patient up, use a lot of hardware. And the idea is that can we do that minimally invasively? And certainly one of the most minimally invasive ways it would be to not really do the surgery at all, but just be able to systemically deliver stem cells to the targeted site. And so our theory is that we're going to deliver stem cells, but use other small molecules or drugs. And these drugs would help hone the stem cell to the injury site. So we found a drug that we use right now, and we've done this in animals, large animals, where we can actually give the stem cells systemically, so by IV, and then depending on the drug that we give the patient, we'll be able to target those stem cells to bone, to disc, even to other injured organs, spleen, liver, just by the molecule that we give.